Hey, Dr. Derek Nielsen here. I am the owner of Kaizen Physical Therapy, where we help people who are age 40 years and older who have been dealing with pain for 6 months or longer. We help them get back to being active, mobile, without pain meds, injections, and surgery. And as the title talks about, I want to talk about low back pain and how it's usually not a low back problem. But first, if you're looking for a solution to pain, I did just release a book where I dive into the reason why the far majority of people have pain and what a solution looks like. You can find that for free for download at thepainreliefbook.com, painreliefbook.com, and you can download it for free. Okay, so the reason why the far majority of people who suffer with low back pain, what the problem is you're going to hear me say this a lot. The area that's overworked is the area that hurts. Now, for example, if I sit in a chair and I sit here for 3 or 4 hours, undoubtedly my low back starts to ache a little bit, or my upper back gets tight, and I start feeling a little bit of pain. And the only reason why you feel pain is because the area is overworked. And pain happens to be the signal that the body and the brain communicate. That's the only way they talk to one another, is you feel pain. It doesn't necessarily mean there's damage. And in fact, usually it doesn't mean there's damage. But again, pain is the only way that they communicate. And so the far majority of people that I see come into the clinic, it's the same exact example, okay? The area is overworked and the low back is overworked. And it's not necessarily because of sitting. It's usually because somewhere else in the body isn't acting or moving like it should. And the first place I always check are the hips. So the hips are an extremely mobile joint. They rotate in, they rotate out, they go up and down, and they go back and forth. And it can be any one of these movements. If it's not acting the way that it should, it can be any one of these movements that causes some low back discomfort. Because again, the area or somewhere in the body has to make up that difference as you're moving throughout the day. If my hip isn't rotating like it should, and as I move throughout the day, somewhere else has to make up the difference. And it's the area that makes up the difference that hurts. And that area usually is the low back if the hips aren't moving like they should. Again, if you would like to download my free book where I dive into topics like this about why the far majority of people who suffer from pain, what the cause is, and what a solution looks like, go ahead and download it at thepainreliefbook.com. I guess I say all this to, let me finish with this, is we need to look at the full body picture. We need to find out, don't just be confused by pain. Because again, the only way that your brain and your body communicate to one another that something's off is through pain. And a lot of times, again, it's not damage. But we need to look at the full body picture and see what's not moving or what's not participating the way it should. And oftentimes when we clear that stuff up, pain all of a sudden goes away. And so I just want to finish with that is, if you're looking for a solution, one, download my free book at thepainreliefbook.com. But also, if you're looking for a solution, go to somebody, please, that looks at the full body and how it's moving from head all the way to toe, no matter where the pain is. I hope you benefited from that. I would love if you did. I would love it if you share it out, and I will talk to you soon. Thanks so much.